as they become available. So welcome to our IMT webinar. Just a little bit about what we'll be covering today. So we'll introduce ourselves properly. Some of you may have worked with us, some of you are completely unaware of who we are. So we'll go through what we get up to and who we are. And we'll give you a detailed breakdown of the interview structure. I think that's really important because you need to be familiar with, what's going to be there for you. And then we'll break down the stations even more. I'll give an example clinical scenario and essentially our tips and tricks on how you should answer it. And then there'll be hopefully some time at the end for a Q&A. So the Excel interview team, so this is me on the left. So my name is Mehek. I am a cardiology SD6 trainee. So I've done, my entire training here in the Southwest. Actually, I did foundation up in Wessex. And I did my IMT down in Peninsula. So I'm very familiar to, the whole IMT recruitment. We've been also doing this course for a couple of years. So hopefully we'll be, of good benefit to you guys. Amin and Berkey, I'll let you guys introduce yourselves.
Thank you, Mehek. My name's Amin. I'm a neurology trainee based down in the Southwest in Plymouth, and I'm doing an out-of-program fellowship here in Wessex Neurology Centre at the moment. We've been doing this course for the last 3 years, and I think it's been a great experience mentoring a lot of foundation trainees and international graduates to get into the IMT program. And we're all here to really help you.
Yeah. My name is Berkay, guys. I did my IMT back in Cambridge, and now I am doing rehabilitation medicine in London. It's an excellent training. So if you are thinking about rehabilitation medicine, it is not well known as not much well known, at least as cardiology or neurology, but it's quite rewarding.
You made the smartest decision, Berkay.
Possibly so. I don't have any on calls, and. So basically, as Mehek and Amin told earlier, so we built this great course and we have helped dozens of students, close to 100 now. And we believe that we are very successful compared to other courses. And we would like to help you as well. And this year is especially competitive. So I'm very happy that you are here now.
Thanks, Berkay. Yeah, I think Berkay summed it up beautifully. So yeah, we realized that, it's getting more and more competitive, and a lot of you, would have approached us individually to get some help. So we came up with this idea a couple of years ago to set up a formal course and just be able to, give our experience and also just help prepare people, give them a little bit more one-to-one time because it is so important. And as we know, there's a huge kind of lack of fellow jobs, and locums are drying out. So everybody really does need to get into training, and you want to get into the training program that you want to do. So yeah, that's why we've formed this course. Okay, so introduction. I probably don't need to go into this in a lot of detail, but yeah, just a little bit of background. It was previously called core medical training. It's either 3 or 2 years, depending on the high specialty training that you end up applying to. So group 1 versus group 2 specialties. There's a whole list on the GRC PTB website that you can look up. I'm not going to go into detail. IMT3 is also called your first med-reg year. And it is one of the largest residency programs under the Health Education England. So it's hugely popular. So timeline for recruitment this year. So you guys are all going to be hopefully in the green box. So the long list will be confirmed next in December, followed by shortlisting, and then invitation to interview booking deadline, interviews held, which is, we want to get you to that stage. So yeah, there we go. Eligibility character. Is there anybody here who's not applied this year and they want to know what you have to do to be able to apply for IMT next year? Because I'll only go through the next few slides if, there is somebody who hasn't applied for IMT already.
I believe we can mention Mehek because we're going to upload this on YouTube as well. So it's going to be beneficial for everyone.
Okay, all right. Well, yeah, so eligibility criteria, completion of foundation competencies, either via UK foundation program, CREST form, Or obviously, if you're already in a specialty program, but you want to switch to IMT. Experience, generally you require 24 months of experience before the start of IMT. UK visa eligibility for IMGs at the moment, there's no restrictions. And GMC registration, you will need full registration before the commencement of your program. So the application form is sectioned into different areas. So part one is a lot about yourself. So, your personal details, equality, diversity, employment history, your training history, what you've been up to. They really want to make sure there's no gaps in your training history. And if there are, then what have you been up to? Then you need some good references. You need to show that you're fit to practice. There'll be a few declarations, competence and eligibility. Then they'll check that on the basis of your answers, evidence, supporting evidence, and then the self-assessment where you score yourself. Application scoring. So this is important for anybody who's planning on applying for next year. Only score completed achievements. And yeah, do not overclaim because, it can be caught out and then it really wouldn't look good on you. So yeah, just make sure that you've done everything that you're claiming points for, or you're in the process of, if you've got a publication that's been accepted, that's fine. If you've got more than one achievement in a single domain, then choose the achievement that has the highest score. Yeah, it goes without saying. Um, Achievements in multiple domains based on a single achievement are allowed. And there'll be a text to explain the achievements. So if you're, confused whether your particular achievement qualifies, then please do read all the small print. The shortlisting score last year was 16 to 17. Um, and the pre-interview score usually accounts for about 20% of your final score. So just a little bit about, again, this is all available online, but the application scoring. So how do you score yourself? Some of you would have already gone through this. The first domain, which is the postgraduate qualification, it goes from 0 to 4. So obviously you don't score anything if you've got no postgraduate qualifications. You get 1 point for having a PG cert or PG diploma. You get 3 points for having a master level degree. And you get 4 points for PhD or MD by research. I mean, if there's anybody around who's actually done that. Um, Domain two, presentations. So you get 2 points for either having a poster at a regional or local meeting or having a presentation at a local meeting. You get 3 points if you've got a presentation in a regional meeting, an oral presentation. 4 points if it's a national or international meeting poster, and 6 points if you're a national or international meeting oral presentation. So if you're in the process of kind of getting ready for IMT applications next year, then this is really stuff you need to know in and out because you want to be getting yourself to the position where you're scoring almost maximum points on all these things. So publications, you get 1 point for published abstracts, which are in non-peer reviewed articles. You get 3 points for being a first author or joint first author in a PubMed cited original publication. You get 5 points for writing some chapters in a book related to medicine. You get 5 points for being a first author or a joint first author in more than one PubMed cited other publications. Co-author, 6 points for being a co-author in PubMed cited original research, and 8 points for being a first author or joint first author in original research. I must admit the 6 and 8 points are quite difficult to score in this section, especially if you're somebody who's coming straight out of foundation. And I think most people would be scoring 5. So if you're going for a 5 in this, I think you should be pretty satisfied.
So what I check in
Yeah, you
this
want to say something?
section,
Yeah.
yeah, if you don't mind. So basically, I believe most of the people have scored 6 to 8 here because the minimum score they had to score was 22 to be shortlisted. Obviously, they get additional 5 point if they only apply for IMT. But I believe most people hit the 8 score. So people will be talking about their publication in the interview when they are telling their suitability. So this is very competitive year. I talked with a few people, like 10 of them. Almost all of them had like some sort of publication. So we need to talk about it in the interview section as well.
Okay. All right. So yeah, domain 4, teaching experience. This is, I think, pretty easy to actually score maximum points on. So you get 1 point for just, providing some bedside teaching on occasional basis, which all of us would have done. You get 3 points for providing regular teaching. and you get 5 points for organizing a teaching program. And actually, it only needs to be taught for at least 3 months. I think that's really feasible. And, if you plan ahead, there's lots of teaching areas that you can target. So hopefully, you would have all scored five on this domain particularly. Training and teaching. So you get 1 point for any course that you've taken, which is below the level of PG Cert or PG Dip, and then 3 points for a PG Cert or PG Diploma. Again, it's quite difficult to score 3 points unless you've done a clinical fellow year and you've been awarded a PG Cert, which a lot of people are doing, to be fair. So some of you may have this. Um, and then the QIP, so you get 1 point for doing a single cycle QIP and contributing to some stages. You get 3 points for doing 2 cycles of QIP, and then again, you've contributed in some of the stages. And then you get the full points if the QIP has finished 2 cycles and you've actually contributed to all the stages. And I think with the QIP, when I was reading the fine print, you don't actually have to have presented it. So the QIP, just has to be done. It doesn't need to be presented at a local audit meeting or nationally or, regionally. It just needs to be done. So that's it about the kind of pre-interview application. And then now we're actually going to move on to where most of you are. Hopefully, you probably all have, got being shortlisted or longlisted. And then we'll go through the interview structure. So this is slightly different to last year. So the station one consists of 2 questions. So your question one is the application and suitability for internal medicine training. And the question two will be the ethical professionalism and governance. And then there's a separate station, which they've called station two, which is the clinical scenario. And then within the station, within all stations, you'll be getting a communication assessment. Although the communication mark, I think, is awarded based on the station one. So your clinical scenario is more obviously your clinical knowledge. As long as you can communicate what you want to say about your patient or the case well enough, you're not going to be awarded an extra communication mark. However, in station one, both the questions, it's very important that your answers come out as structured and clear because you will be getting that communication mark. So again, just a little bit more about the stations. So the first station will consist of about 11 minutes, and on each station will assess you on 3 areas. So overall, you're going to be scored on 6 areas. Overall, the interview is about 30 minutes. So station one, like I said, goes through your application achievement, suitability for IMT, followed by the ethical professionalism and governance station, and then the communication mark. And then station two is just the clinical scenario. And there is 1 minute when we go through it again in detail later on today. But you'll be given a minute right at the end of finishing your clinical scenario where you'll have to hand over the patient. And that's a little bit more about communication. So going through question one in station one, so that's the application suitability. It's roughly divided into 2 sections. So you get 2 minutes to showcase the best parts of your portfolio. So that's that's how you lead the interview. That's how you'll start off the interview. So it really puts you at ease because this is more about you and something that you've had time to prepare. And then we'll follow some questions on suitability to be an IMT. And it will mostly be an expansion on what you have said already. So it's really important that whatever you've said, you've really thought about it because more, likely than not, they're going to ask you questions based on what you've said. So yeah, I've just put there, this is all really about selling yourself and you need to know your portfolio inside out and come across as structured and prepared. There's nothing worse than having, a trainee opposite you who actually doesn't really know about their own achievements. You want to be able to, everyone who's got to this stage would have done similar things, but you really need to know, why you did it, how you did it, what are the skills that you learned from it, what are some of the things that you'll reflect on and change for the future because that will make you come across as someone who's really thought about their answers, who's really thought about their achievements. Sorry, did somebody want to say anything? Okay, Amin and Berke, do you want to add anything?
Yeah, this section is really important. Knowing IMT is also very important. So IMT is a bridge. IMT is not an end goal. So what you're going to do after IMT, you need to have some understanding about as well. So some of the people may say, okay, when we do a mock test, especially IMGs, they say, I want to be an internal medicine specialist. Yeah, but we don't have such a thing. What you're going to be next level? Are you going to be a rheumatologist, cardiologist, neurologist? What is your end goal? And how this end goal is going to be helped by having an IMT? So you need to have some sort of understanding as well. What are the core curriculum findings of the IMT? Why it's important to be a good neurologist? Why you need to be having an IMT degree? This is another thing. So you need to have concrete understanding of the IMT curriculum.
Okay. Thank you. Oh, by the way, I didn't say at the start, if you've got any questions, you can either raise your hands or you can write in the chat. I think Amin is moderating the chat, so he will share the questions with me and we can try and answer them for you. Um, so then moving,
Mehak,
hello,
we can hear you.
Amin?
Yeah, you
Did
can.
Amin try
I
and
can
say
hear.
something?
No, no, no. Please go on. Yeah, I did not say
Okay,
anything.
fine. So yeah, so then question two is your ethical professionalism and governance question. So the situation will be read out straight away, basically, and your station starts. So it's not something that you would have prepared, or you would really get some time to think about, which is why practice is even more important with the ethical station. It's about 5 minutes long, and you get 5 marks from each interviewer. You do have to remember that this is not a clinical question. So although the situation may be around a clinical scenario, please don't make it all about that. Although I would also still say that you don't want to get anything wrong. So don't be completely blasé about the fact that this is, not a. Oh, can you guys still see my screen?
Yes, we
Yes.
can, Mehak.
Yeah. So yeah, don't be completely blasé about the fact this is not a clinical scenario, so I can basically say whatever. You still want to, show them that you're a doctor and you've made the patient safe. But the key things that are being assessed are familiarity to to good clinical practice, principles of ethics, understanding what clinical governance is, familiarity with GCP, so good clinical practice. A lot of this is available on GMC, so you need to have a read. I think it's an A4 page in one of their PDFs, which talks about good clinical practice. And you need to read about that because what you need to do is whatever the scenario or situation they give you, you need to be able to draw out those principles and relate it back to the question. So yeah, so what do the interviewers want to hear? They want to hear your understanding of these topics and know that you will be able to manage an ethical dilemma or, a situation where your professionalism or clinical governance is in question. Um, Anything that you guys on?
I believe this section is quite important because there are a lot of details in ethics that you need to answer. You need to answer very firmly as well. And good clinical practice, obviously, please read it through, but it's not going to help. There are certain scenarios that you need to be very familiar with, especially some of them are communication skills scenario, especially IMGs might be familiar with from PLAP 2. Most of the things that you may need to know is very similar, but you need to give much deeper answers. And how you paraphrase the answer is also very important. Like saying the things one by one is one thing, but giving a background information, giving like GMC guidance and how it relates to that situation is very important. So again, this is another subject that you need to prepare yourself. Like even though saying that, okay, for example, a pharmaceutical company tried to give you some sort of like gift, how would you answer this question? Obviously you shouldn't have it unless it's going to cloud your judgment. But saying this not enough. Okay, how it relates to GMC guidance, you need to give example. Yeah.
I just wanted to
Okay.
add that this is one of those sections where you can score the full marks more than and this and the clinical scenario. I think it's completely up to your familiarity with the GCP and the good clinical practice. And I think you can really, really score the full marks. And I think through this course, hopefully we can help you all score the full marks in this section.
Yeah, I agree. I think again, a lot of these questions require good practice and having a structured answer. if you've got a structure in your head that works, when you've done your practice, then on the day, whatever the scenario is, I think you'll just be fine. But yeah, I think a lot of people undermine is practice, 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 and coming across as confident and structured on the day. So I'm going to move on. So then the station two, the clinical station, which is, the question where actually a lot of people feel comfortable because it's medicine and you think, we obviously by the time you apply for IMT, you think you're good at medicine. But again, it's a lot about having a structured way of answering whatever whatever situation they give you. Because what you don't want to do is look like you've been thrown off by the situation or you don't really have a way of addressing the question and they're not able to follow you. You want to make it easy for them. So they're able to follow you, they're able to tick the boxes on their marking sheet in front of them and score you the higher points. So just a little bit about this structure. It is divided into two sections. So you'll be given a brief scenario straight after the ethical station. And you can make notes whilst the scenario is being read out. I think historically they used to give you a couple of minutes to make notes, but actually this year they're not doing that. They're just going to start the questioning straight away. But they have said that you can have a piece of paper and a pen, and as the situation is being read out, you can, and I highly encourage this, that you do write the question down because you don't want to keep asking your interviewer, oh, what was the question again? Or, how old did you say the patient was? So you want to write down the keywords. And if you want, make even a few notes, and then you'll just sadly have to, commence the station. And then after that, you get 1 minute to hand over to your colleague. So what are the key principles being assessed here? It's your assessment skills, it's your diagnosis, it's your management, and ultimately it's your communication and escalation. Remember, most people who are applying for IMT, they're F2 level, or they're supposed to be F2 level. They're not supposed to know it all. They're not supposed to be medical registrars. So it's very okay to say at this point, I'll want to seek the opinion of my senior colleague, or I'll escalate to my senior colleague, whether, it's a senior SHO, whether it's a registrar, whether it's a specialist registrar, right? So if you've got a cardiology scenario, somebody in flash pulmonary edema, you may want to just let the cardiology reg know, in case they need a GTN infusion, CPAP, blah, blah, blah. So it's very okay to show that you're aware that there are other specialties, out there that will help you. And then, the 1 minute handover assesses your communication and structured handover skills. Any more thoughts from you guys about the station?
I believe you summed up really well.
Yeah.
Yeah. So then I've got some key topics, which again, over the years where we've conducted this course and, our colleagues and friends who've told us these are the kind of scenarios that have come up. This list is, non-exhaustive. There's lots of cases that can be asked in any topic areas essentially. Just kind of going by areas. So in neurology, they can give you acutely dizzy patient, they can give you seizures, they can give you acute focal weakness, headaches, confusion, unconscious patient, cardiology and respiratory. I've just grouped these together. But you can have a chest pain, which could be either rest or cardiology cause. So ACS, PE, dissection, pneumothoraces, breathlessness, asthma, COPD, non-infective COPD. Again, PE could go in that. Acute desaturation, tachyarrhythmias, AF, SVT, broad complex tachy. They can also give you that. Gastrointestinal, GI bleeding, acute liver failure, IBD flare. You can have a general medical situation like sepsis, DVT, flank pain, falls, AKI, anaphylaxis, endocrine, DKA, HHS, adrenal insufficiency, rheumatology. I've got joint pain, RA flare, reactive arthritis. But like I said, essentially it could be anything. But what you will hopefully learn from our cases, from our course, those of you who sign up to it, and then potentially our one-to-one tutoring is, how we help you to structure your answers for any topic that you may be given. So I think what I wanted to do, and we've still got the time, I wanted to give an example scenario to Amin actually, and show you guys how we would suggest, answering a question. And there's no kind of right or wrong approach. Is an approach that works for you, but it has to work. And just over the years that we've done this and having done it ourselves, this is, our approach, and we think that it works. So, I mean, are you ready?
Yes.
Okay. So I'm just going to go straight into the question because they're not now
Yeah.
giving you, any time to write down stuff.
Okay.
Here goes. So you've got a 35-year-old woman who has got poorly controlled type 1 diabetes, and she comes into the hospital with abdominal pains and fevers. Could you please kindly assess this patient and take me through your management plan?
Okay, thank you for the question. So first of all, I'll start by getting a focus history from the patient and try and understand the onset of the symptoms and other systemic symptoms that she has. I would specifically do a systems review looking at infectious symptoms. I would also inquire regarding her type 1 diabetes control and compliance with the insulin. Specifically, I would be interested in knowing if she has had any previous admissions to hospital due to any diabetic complications. I would also ask briefly about the social circumstances and family history. And after this, I would go straight to do a quick focused A2E assessment. And in the A2E assessment, in the airway, I would ensure that the airway is patent and see if the patient is able to talk to me. And if I have any suspicion of an impending airway collapse, I would try and insert an airway adjunct, such as an OP or an NP airway. And I would be quite concerned if the patient is tolerating any of these airway adjuncts and seek help from the critical care team or my senior if there was a problem with the airway assessment at all. And in regards to breathing, I would look at the observations, specifically the oxygen saturation and the respiratory rate. Now, if the patient was hypoxic or if the patient had an increased work of breathing, I'll start the patient straight away on supplemental oxygen therapy. I would also try to get a PEFR and an ABG done for the patient to see what the pH, PO2, PCO2, and the lactate are looking like. I'd be very concerned if the pH was quite low and if it was in keeping with a metabolic acidosis, given the history of diabetes in this particular case. I would also arrange a portable chest X-ray for the patient if I found anything on my focal assessment of the chest. Now, in regards to circulation, I would look at the observation, specifically the blood pressure, the heart rate, and the cap refill time. And if there was evidence of hypotension or tachycardia, I would give a fluid challenge to the patient to see if there was an adequate response. And if the patient remained hypotensive despite the first fluid challenge, I would give another fluid challenge and ensure that my senior and the critical care team are aware of the patient. I would also ensure that the patient has a working cannula and ensure that all the septic screening and the bloods are taken from the patient. It would be quite important to do an ECG for this patient in this acute situation. Now, in regards to disability, I would check the patient's blood glucose, capillary ketones, temperature, and do a focused neurological assessment that includes GCS. Specifically, if the GCS was less than 8, or if there was a focal neurological deficit, I would be quite concerned and investigate this further and ensure that my seniors are aware
Okay,
of
thank
what's
you,
going
thank you,
on.
thank you for that. That was very thorough. So there's been a development. So we found out that the patient has had 2 admissions quite recently with DKA, so diabetes ketoacidosis. And your colleagues have found out that that is mostly due to them being non-compliant with medications. She, although states that she is compliant with her insulin therapy. Um, she also says that she's recently come back after visiting her sister's children who had the bug. So you have ordered an ABG. That's great. I'll tell you what the ABG shows. So the ABG shows a pH of 7.2, PO2 is 12, PCO2 is 2.2, bicarb is 14, lactate is 2.0, potassium is 3.2. And her capillary ketones are 3.3. How would you like to proceed?
Okay. So, based on the information that I have so far, due to the history of the non-compliance and the fact that her ABG is clearly showing signs of a metabolic acidosis, I suspect that this patient has DKA and I would need to act quite quickly. The fluid loss is the most important thing to correct in this particular situation. So I would ensure that IV fluids are started promptly for the patient, and I would also need to start the patient on fixed rate insulin infusion as per the local DKA protocol. The aim would be to primarily give at least 1 to 1.5 liters of fluids in the first hour, depending on the blood pressure, and start on IV insulin therapy at zero point 0.1 mils per kg. I would also ensure that I hand over to the nurses appropriately to do hourly capillary glucose and ketones monitoring to ensure that the patient is improving and
Okay,
DKA
great.
is
Thank you.
resolving.
So where would you like to manage this patient?
So first of all, I would like to ensure that this patient is in an appropriate setting, that is ideally in a resus area or in a HTU.
Mhm.
And this is where I would like to manage the patient, given that the patient needs at least one-on-one or 1:2 care is needed for this patient.
Okay. And you mentioned initially about complications associated with diabetes. Can you just mention a few of them for me?
Yeah, so there are different kinds of complications that can be divided into macrovascular and microvascular complications. So diabetic ketoacidosis and HHS are two of the diabetic emergencies that need to be treated promptly. The other complications that can happen in macrovascular settings would be strokes and heart attacks, and microvascular complications would be retinopathy, nephropathy, and diabetic neuropathy.
Great. Okay. And who would you like to involve in our care?
So, in the first instance, if the patient is not resolving in terms of her DKA, I would like to involve the ITU, or if the GCS is dropping, I would like to involve the ITU as soon as possible. I would also like to involve my medical registrar on call. And if the in the during, let's say this patient is coming during the night time, I would make sure that the patient gets a diabetic team review in the morning as well. This is what I would do.
Great. Okay. So you've started this patient on a DKA protocol. She's responding well. She's got a chest X-ray pending, and her flu test has come back positive. It's almost time for you to end your shift. Please hand this patient over to your colleague taking over from you.
Okay. So thank you very much. So I would like to hand over this 35-year-old female who's got a history of poorly controlled type 1 diabetes. She's had a history of two previous admissions to the hospital for DKA, and she presented with abdominal pain, fevers, and on assessment there was evidence of um, basically she's got signs of metabolic acidosis on her ABG, with the ketones being 3.3. So we have initiated her on the DKA protocol, and she seems to be on the mend at the moment. She does not have any signs of low GCS or worsening of her gases as such at the moment. The medical team, medical registrar, is aware of the patient, and I would be grateful for your review to check on the patient and to make sure that the gases are getting better, and to ensure that the patient can be switched to variable rate insulin infusion once the decay is resolved.
Okay, thank you very much. Thanks, Amin. That's the end of the scenario. So yeah, well done. How did that feel?
Well, it made me go back to my go back several years when I did this scenario.
Yeah,
I mean,
yeah.
I don't know if the others in the room know that neurology does not do a lot of gen medicine. So this is me
It's been a
going back.
while.
Yeah, it's
Yeah.
been a while. Yeah.
Yeah, yeah. No, you did really well. So, guys, what I'd like to highlight here is that what we propose is, there's two essentially way of approaching any clinical scenario. You can either go straight in with an A to E, or you can do a systems approach, or you can do a combination of both. So, what Amin has demonstrated there is a combination of both. And he's done that because, if I may speak for you, Amin, he's done that because his patient was quite stable. So if you're giving a scenario where your patient, they've said, oh, the patient is quite unwell, they're tachycardic, they're hypotensive, then firstly, you need to show some urgency. So you need to move the patient to, you want to ask the patient, or you want to assume that the patient is, let's say, in an unsafe area. So you want to start off the scenario by saying, I'd like to move this patient to at least a major's cubicle, a monitored bed, or ideally a resus bed if the patient is already not in a high obs environment. So you've shown that you're a safe doctor and you know that what level of, care this patient is going to require. And then depending on, if your patient is hypertensive tachycardic, I would suggest that you start off with an A to E assessment, or let's say that they are confused or they're not able to give a good history. Obviously, a ME's patient, the vignette didn't say that they're, unstable or they're unable to give a history. So he went with the systems approach, covered each system very thoroughly, and then did his A to E assessment, which I think worked beautifully with this case. But you just need to be able to kind of suss out the situation, judge it and think what's going to make me look like the safest doctor here. And again, if you sign up to our course, we'll go through a lot more scenarios, and if you want to have one-to-one interview practice with us, then again, we'll do a lot of that. Any questions on the chat about this scenario, Amin? Because I can't see the chat right now.
No, I don't think so. I just wanted to add that even in an emergency scenario, let's say you do the A2E approach, the interviewers obviously like the fact that you tell that you try and get a collateral afterwards. It's
Mm,
always a plus.
mm,
So let's say there's a stroke
definitely.
patient who's coming into the hospital, or a patient with VT who needs to be cardioverted coming into the hospital. You might not have time to take a history straight away, but if you do the A2E and then say that, okay, I've stabilized the patient now, I'm going to go and get a collateral. That would add a lot of points essentially. Yeah.
Yeah, definitely. And it's all stuff that we do when we, make our plan for the post-it roll down in the morning. We always write, collateral history when possible. So it's all stuff that you actually already do and you know that is expected from you. But it's just, having a routine and having a structure so you don't forget it on the day. Okay, moving on from that. So top tricks and tricks. So I thought Amin and Berke, you can give us your top two tricks for IMT interview. So I'll start with you, Berke.
So I believe confidence is the most important thing. If you look confident when you are giving your answer, it has a weight, and also you need to prepare a lot. So practice your answers over and over again. 2 minutes is quite strict. That day is very stressful for the interviewers as well because they need to talk with like 10, 20 candidates. It's a very tiring day, and they are very strict with the time. So if you mumble, they're not going to give you additional time, unfortunately. So please practice, practice, practice.
Thank you.
I
And
think
Amit, moving on to you.
I think I just wanted to add that, structure to the answer is of utmost importance. Like the structured you
Mm,
are, the interviewers are able to listen and absorb what you're saying easily, and they are attentive. And remember that you probably might be the 10th or 15th candidate that they are interviewing, and they're going to be fatigued. And it's important to be structured so that you grab their attention. And this only comes through rigorous practice. And I would suggest if anyone hasn't started practicing to start straight away,
mm,
even if you don't know when your interviews are going to be.
yeah, I agree with all of that, and they're a really good piece of advice. And I'd just add on, just basic stuff like having an environment that you're comfortable in. You don't want to be sitting on a wobbly chair. You want to be able to make eye contact with the interviewers. So just having a, glass of water next to you, because these little things can, really help you. So yeah, on top of everything Berkey and Amin said, just know your surroundings, be aware of how you're coming across. I actually practiced myself a couple of times in front of, the laptop and recorded myself. I had some sort of a software on my computer, which was free actually, and just practiced giving my 2-minute presentation and then played it back to myself to see how I was coming across. Because we don't, know our body language until somebody tells us. Us may use a lot of hand gestures. Some of us, may play with our hair. So I think it's really important just to be aware of that. So you're not distracting the interviewer of what you're saying. So yeah. Okay, so yeah, your interview day, I think this just goes a little bit more in depth of what we've already said. So ensure you're prepared, have a stable internet connection, dress to impress. I think that's what I was saying essentially, and no distractions. So the story that I tell everybody is on my IMT interview day, I wore a watch as you do, and we were like the last cohort where they did in-person interviews. And my watch was slightly loose. And when I went into my portfolio station, I may have been using my, I think I was sitting close to the table. So when I was putting my arm down, the watch banged the table, and it may have done it a couple of times. So when I got my feedback, they actually wrote that the candidate may wish to wear a more fitted watch the next time because it is distracting, and we haven't deducted any marks. But she may wish to wear a more fitted watch. So yeah, it's just little things like that. I mean, who would have thought they would have, picked up or even made a comment about that? Yeah, so be ready to log on 15 minutes before. I don't think you can actually enter the lobby for, literally 2, 3 minutes before because they've obviously got interviews one after another, but just be ready. Have a glass of water nearby. Your IDs will be checked, so make sure you have an ID next to you. And yeah, this is also really important. Just smile, make eye contact as you answer your questions. Obviously, in the clinical scenario and ethical, it's a bit difficult, especially, if your situation is more intense. But in portfolio, this is all you showing off everything you've gotten up to. And as doctors, we're not great at talking about our achievements. So I think, this is our chance to talk about everything we've done. And you should, because, you've all worked hard to get here. So make sure you smile if there's a project that's really close to your heart and, you've done it, then, smile and tell them about it. And yeah, and enjoy the process. You've worked hard. Um, so just a little bit on the scoring frameworks. So yeah, this is how you'll be scored at the interview. The first table at the top is for general questions, and then the second table is for your application and suitability question. So you really want to be scoring in the greens, and actually you really want to be getting fours and fives, looking at the competition ratio. So yeah, I mean the goods and excellence kind of say that if you look at the application and suitability box, so that's the second box, it says that you're expected to perform at the level on completion of F2. And then the excellent is you're performing at the level expected at IMT or above. And a lot of you have done a lot of stuff, that is beyond the capability of F2s. So you're probably going to be scoring at that. You just need to be able to put it across so they know what you've done. Yeah, anything about this, Amin and Berke?
Yeah, I believe you summed up really well again. So be prepared. I mean, 4 to 5s are the only things that you need to aim for, and enjoy the process as well. I mean, the IMT interviews are quite fun. Once you finished it, of course, and you learn a lot as well. I mean, this is something some of you have never done, like structured interview. You learn a lot as you study, so try to enjoy the process as well.
Yeah. Okay, interview scoring. So this is the kind of sheet your interviewer may have. So station one, again, the two questions. So your suitability for IMT, applications and achievement, they both get to score out of 5, and then the weighting on this is 1.6. So it is really important that you're able to, tell them exactly what you've been up to. Question two, the weighting is 1.2. The communication mark actually has quite a high rating of 1.6. And then the clinical scenario, the patient handover and communication, as you can see, is quite a big station as well, with quite a lot of points. So overall, you get a point of 70. And then there's a added weighting, and overall it'll be out of 96. Just a little bit about, after the interview, for those of you that we may not get to see again. So an email for preferencing is sent, and the deadline would be, as mentioned in the email, but also what we've been through before. And just make sure you guys have, regular kind of check-ins on your junk email, because a lot of my oral emails always used to go to junk for some reason. And then once the rankings have been sent, the first set of offers are made. And you'll have an option, obviously, to accept with upgrade, hold with upgrade, or decline. I think unless you've got, serious compulsions, I think these days you pretty much just have to accept, and you can obviously accept with upgrade, because I think the competition ratio is just going to get tougher and tougher from, next year. Um, and then the individual DNV contacts you for completion of documentation. They may send a welcome email, so the rest of it will follow. So now, why is it important to be well prepared? I mean, all of you have come to this webinar today. It shows that you guys are obviously committed to doing well at your interview. But just a little bit more about numbers. So in 2023, there were 4,406 applications made, and there were only 1,572 posts. So that gave a competition ratio of 1 to 2.8, which I guess in some ways is acceptable. In 2024, the applications went up to 6,273, and the posts went up slightly, 1,698. That gave a competition ratio of 1 to 3.69. But this year, it will be 8,841 there've been 8,841 applications made, and there are 167 posts. In fact, it's actually gone down since last year. And the competition ratio that is expected is to be is 1 to 5.27. I think that's huge. Historically, you would not be looking at anywhere near this. So it is, difficult to get in, and you will have to do well.
Yeah, yeah. I mean, Mahek, that's very interesting because only time that people wanted to come to interview courses was the time that actually they want London, Cambridge, Oxford, these
Yeah,
very competitive
yeah.
IMT places. But now, even just to get into the training, you need to smash your interview and you need to come to courses, you need to prepare excellently. So it's very different era now.
Yeah, I agree. I 100% agree. I think back in the days, people wanted to, score those top marks to get a good rank so they could have some say of where they're going geographically. But I think now is just, bare minimum. You just want to be able to get a place on to the recruitment. And pretty much anyone, that I know goes everywhere essentially, because it is that competitive. So
Yeah.
things have really changed in the last few years, sadly. So how we can help you a little bit about again us. So we've got our website, Excel Interview. So you can go on that and look at different kind of bundles we offer. We will put up a comprehensive and interactive course, and the dates of that will be released soon. There are online materials on our Excel Interview website with scenarios, so you can practice at home with model answers. We offer one-to-one interview practice as part of our bundles. And I'd say, generally we're an accessible and friendly team. Of course, we're all very busy. We're, registrars working full time. However, none of us really mind if you want to drop us an email to ask something, even if, it's not part officially of your one-to-one mentoring or whatever. I think if you book a slot with us, then you're more than welcome to ask us questions as they come to you. And I think that's right, isn't it? I mean, in Berkeley, I'm sure none of us
Yeah.
would mind if you have thought about anything and you want to, ask.
Yeah.
Yeah. Okay. I just have a video feedback from one of our previous IMT trainees. I mean, she's a current IMT trainee, but somebody who we got through. So I don't know if you guys can see. Can you guys see Rima?
Yeah.
Mhm.
I just want to play the video and just, just give everyone a little bit of. Does it play?
It hasn't started yet.
Can you guys hear?
No.
Ah,
I believe there must be a. Let me share in the.
pardon?
Let me share on the chat because we have it on our Instagram.
Okay.
Mhm.
Yeah, it's not the end of the world if you
Yeah.
can't see it, but this is on our website, on our Instagram. And I just thought, a very honest review, hopefully, from one of our current IMT trainees who did some interview practice with us. And, so it's always good to hear from people.
I
And I
shared
just
it on
want
the
to add
chat.
that fortunately we've had candidates who got ranks of 200 even last year. And I think it's obviously due to their effort, mostly due to their effort, but we were happy to be, helping them and guiding them. And I'm sure that, we can help all of you achieve this, hopefully. This is what I'm hoping for.
Yeah. So
This is, yeah, question and answers. Please do ask. We're more than happy to stick around for 10 minutes and answer questions.
so I believe the most important that how you're going to prepare for it. So what I would suggest, please study the materials that on the website first. Then we're going to have possibly two courses, one in December and one in January. Whichever is suitable for you, come to one of them. And it's going to be very comprehensive, a full day course. We're going to go through every section in the interview. And lastly, at least 1 to 2 weeks before your interview, book your one-to-one session so you can actually have a mock interview and optimize your answers. How can you sign up? We have a website. Let me share the website with you as well.
Yeah, I think that'd be great if you can just show them our website. We actually, so for those of you who've attended today, we do actually have a Black Friday discount because why not? So there's a bit of a Black Friday discount that we've got on the website. So the sooner you sign up, I guess, the more money you can save because we all love saving money. So yeah, have a look on the website and try and reserve as soon as you can so you get a bit of your you can save a bit of your money. I mean, it'd be great actually if you could, sorry, Berke, it'd be great if you can share the website and just show them around the website.
I shared it on the chat, but I can share my screen as well. No problem. Yeah, so you can you see?
Yeah, we can see your screen now. Yeah. So yeah, so this is our website.
Exactly. This is our website. We have close to 100 cases. We have videos, we have materials, we have some questions as well. So we have drop our prices for the Black Friday as well. So please feel free to join as soon as possible because it's going to be only temporary. And as I said, when you book for like premium package, uh, try to go through the online materials first before coming to the course. And 1 to 2 weeks before your interview, get your mock interview so you can actually see yourself in your most prepared version. And then, according to feedback, again, optimize your answers and go into interview with confidence.
Great. Any questions from anyone? Please do ask. We're here.
There's somebody asking for the 1:1 session. How does it work? So Rachel is asking this question for the 1:1 session. How does it work? Would it be a single session of mock interview, and how long does it last? Or can it be tailored to be multiple sessions to refine answers? So I can take that if you want.
Yeah.
So
Yes,
so
please.
yeah, Rachel. So for 1:1 session, it would be a single session of the mock interview. So that'll be mock interview for 30 minutes, and then the next 15 to 20 minutes would be actually the refinement of your answer and making sure that we give the appropriate feedback. If you want additional mock sessions, we are happy to provide that, but it would need to be booked through our online system, which we'll update on our website.
Yeah, so I think, yeah, just to add to that, I mean, it's right. So as per our plan, it comes with one-to-one, a full mock interview though. So it'll be fully done in interview circumstances actually, and you should come prepared like that. And obviously then there's detailed feedback, which in the past people have found really useful. However, if you wanted to book up a follow-up mock, then we could offer that at a reduced price, because you've signed up through our services. So we can definitely do that. For those of you who sign up to our course or the bundle, which you get the course access to as well. Within the course, we'll do a couple of mocks. So please do get involved because that'll just mean you'll get to do more mocks. Yes, in front, it'll be in front of a few people, but at the end of the day, we're all learning here, and no one's perfect. So yeah, so you'll get a couple of extra mocks that way if you choose to kind of take up our questions in the on the main course day.
So there's another person who's asked the question. So Kutsi has asked, what would a small group mean? So
Sorry, what does that relate to? The course or?
I think the small group interview, small group practice, that's what she means, I think. So you can take that
Yeah, I mean,
question.
the small group interview, that's relating to the course, isn't it? So within the course, we will do some interview questions, and you can answer them as a group, you can answer them individually. So yeah, so that'll just depend on the day of the course. If we've got quite a lot of attendance, then we might do breakouts room. But if it's a group like this, where there's less than 20 of you, then you might want to tackle it as a group. But like I said, we're pretty accessible, pretty flexible even. So if there's a way that you guys prefer on the day, we're more than happy to tailor it that way because at the end of the day, we want to make sure that you learn something from the day. We're not rigid in the way that we want to keep things. So yeah, essentially that's what it means. If one of the days is really full, then we'll try and go into breakout rooms and you can answer questions that way.
Mm-hmm.
Any other questions?
Don't see anything on the chat.
Great.
Great. Yeah. Well, so the link for our website is in the chat, and I'll post it in the group chat again. Thank you guys for attending this webinar today. I know it's a Sunday evening, everyone wants to relax now for the week ahead.
Yeah.
So oh,
Sorry, I had a question, if that's okay.
yeah, go ahead.
So last year I did attend